Welcome back in. Well, the director of the Centers for Disease Control faces some tough questions today from Congress on how the Ebola virus has been handled here in the U.S. Meanwhile, some Americans certainly have a mistrust of what they're being told by health officials about the threat of an outbreak here in the U.S. Joining us this morning with medical perspective is Dr. Edward Kahn, medical officer and disease control physician with the Jefferson County Health Department. Dr. Kahn, always appreciate you coming on. Thank you so much. Yeah. All right, so we've been hearing for a good while now that this virus, which has been around for a long time now, that it can't be transmitted by getting airborne. But now we know that this second person who is affected flew on an airplane, a commercial airplane, and if, say, she sneezed or she drooled on an airplane seat, what confidence do people have that they can't get the virus that way?
Well, I think, a couple of reasons why the risk is still very low. One is that, again, the most closely associated risk of contracting Ebola is direct contact with somebody who's sick with the disease, with their blood or body fluids, secretions, and that sort of thing. The virus can persist if it's, like, say, on an armrest or something. It could possibly persist if not cleansed with a bleach type solution for up to a few hours possibly, but the risk would be low of that sort of transmission occurring. The other factor, which would be that the highest levels of the virus that are shed by a person who's sick with the disease are in the later stages of the illness. So the earlier stages, the virus is at much lower levels, and there would be less in the body
so if they were more symptomatic and then in that case they sneezed and I'm standing near that person, one of those droplets that's when I could be infected, right?
Right, that would be a high risk, yeah.
So now, is this virus capable of mutating?
There is some slight mutations. If you look at all of the, this is called the Zaire Ebola strain, which has caused this outbreak, which originated in Guinea. They have sequenced the virus that's in the current outbreak. They've compared it to previous outbreaks of Zaire Ebola virus, and there is a little bit of divergence from the parent strain. But it's not felt that those mutations have resulted in any clinical differences in the virus.
And you've talked about it before. This thing has actually been around a good while. It's just now become a huge issue. But it also, I've heard health officials say that, we're really just in the initial stages of learning enough about it. So is it possible that what we do know about it could be changing as well?
I think there's definitely some learning that we're doing because as we've talked before, this infection, this disease has, since 1976 caused outbreaks mostly in rural African communities with healthcare that is sort of, on a much more basic kind of a level.
Right.
Now, for the first time, we're seeing the disease in the United States with Western medical technology types of situations like, intubation, artificial ventilation, dialysis machines, like intensive care unit type of facilities. And I think that is a little bit of a new thing that we have not before experienced with this disease.
Now, in your opinion, and I don't want to get political here, but in your opinion, medically, would it be beneficial to ban all passengers from infected countries from traveling into the U.S.? Would that have an effect?
Well, I'm probably not really the best person to comment on that. I know that's being discussed. I think right now, as overall, it's felt that the potential downsides of that may outweigh the potential benefits of it.
And by that you mean if we send medical personnel, trained medical personnel to Africa to deal with these people, we have a better chance of dealing with it, right? And if we is that what you're trying to say? Containing it, I guess.
That's one aspect of it, for sure.
All right, now the second healthcare worker, as we know, just flown to Emory in Atlanta. What do they have in their setup that other hospitals do not or could not at least duplicate?
Well, the Emory, as well as these 3 other centers in the United States, they actually have biocontainment units for handling these high-level infectious diseases. They have these isolation units with, like, double doors and sealed areas and that sort of thing. So they've already been trained and practiced in handling these type of pathogens, which are highly infectious, highly virulent, and so they're more equipped or have already had some practice in dealing with these sort of things.
It's not their first rodeo, so to speak. All right, finally, I've heard from nurses and other healthcare workers, and even the National Nurses United director spoke yesterday about how they feel most healthcare workers within most hospitals in the U.S. are not equipped, not trained, not prepared to handle someone who might come in with this Ebola virus. But we're saying that, hey, we can handle this, it's not an epidemic. So, but are we whistling by the graveyard there?
Well, I know the initial CDC statement was that any hospital in the United States was capable of handling, isolating, and caring for an Ebola patient. And that, because of standard barrier nursing precautions could be taken. And then again, the main treatment for Ebola is going to be supportive care. Intravenous fluids, monitoring of electrolytes, supporting of any organ dysfunction, that sort of thing. I think with what's happened in Dallas, we've realized that obviously with two healthcare workers being infected and and the patient not surviving, I think that the thinking has shifted a little bit more towards a specialized center may be more effective at both treating patients as well as preventing healthcare personnel infections. And a lot of that, as far as the healthcare worker infection goes, is the protective gear may be similar or the same, but it's the practice in using it, putting it on, putting it off. That can make a real big difference if you've done it 100 times before versus doing it for the first time.
Dr. Khan, always appreciate your analysis. Great perspective this morning. Thank you so much.
Sure. Thanks.
All right, we'll talk about this on that subject. Some healthcare officials getting trained in a place in Alabama to go to West Africa to deal with the Ebola virus. Stick around.